Welcome to the Talk with Your Doc presentation. Talk with Your Doc is a turnkey telehealth package that provides virtual appointments for patients and clinicians. This presentation will cover the provider workflow, which includes navigating the dashboard, sending virtual appointment invitations, and joining a virtual appointment. The presentation will also cover the patient workflow, which consists of accessing the portal as a new user, accessing the patient dashboard, adding medical history, and joining a virtual appointment.
Hello, today I'm going to walk you through a demonstration of our new tool, Talk with Your Doc. This is a non-tethered solution that we put together for a provider to be able to communicate with a patient, share health information, and have a video visit. We initially thought to stand this up in the wake of COVID-19 to help people screen their patients and treat their patients and see their patients at arm's length to save our healthcare resources. We soon saw that even a bigger use case was for the video conferencing and the communication and the sharing of data to be for those clinic visits that aren't happening now for the chronically ill. So as you all know, clinics are closed, they're not bringing in patients, and there needs to be a solution for providers and patients to communicate, not only by sharing their data, but also by having video conferencing. So we created Talk with Your Doc. What you're looking at here is the provider view. This is a HIPAA compliant, completely secure solution, and it is EMR agnostic. Again, in the provider view, you're seeing a list of this particular provider's patients. And at the top, we have certain filters. So I am filtered to my patients. You can also filter to all patients so that in your clinic, every provider could have access to every patient. So if one of the providers wasn't available, you could still help all of your patients. And then the other filter brings us to video visit appointments. So this would filter the patients to anybody who currently has a video visit scheduled, and we'll be there in just a moment. But I want to walk through the navigation a little bit on the left-hand side. The way that this is set up, it's set up so an administrator can come in and schedule the appointments and invite patients to the tool. So in the back end, an administrator or front desk type personnel could send an email invitation to a patient to create an account within the tool. The patient would get an email with a link. They would also have an iCal so they can put that video visit on their calendar and give them, again, access to the patient-facing side, which I will show you in a moment. And the invitation process is very simple. So invite a patient with a video visit or invite a patient without a video visit. So if we click on one of those, it's very simple information to enter. If there is already a list of patients that are in the system that have been added, they can also choose one of those, or they can create a new patient to schedule the appointment and invite them to the tool. This would again then trigger that email that would go to the patient, letting them know when the video visit was scheduled for and allowing them access to the tool. If we go back to my patients, I'm going to go ahead and filter to the patients who have video visits. And we're going to speak to Catherine Sanderson. She happens to have 2 visits scheduled, but we're going to go ahead and go into her record. We kept this very simple to meet this use case. What you'll see is just some demographic information at the top. You'll see the appointment list for the patient, and then you'll see this join button. And this is where the provider would click on the join appointment, which we're going to do a little bit later in the demonstration. Below that, there is a section where a provider can add notes about the call. They can certainly also do that in their EMR, but we wanted to make sure they had a place to do that here. If the provider wanted to schedule a video visit, any place on the site has this little plus button in the bottom right corner where information can be added. They could absolutely schedule that video visit for the patient, so they have that ability too. The other thing below here is a questionnaire. So this was set up using the person under investigation form that the CDC put out to screen people for COVID-19. It's a very simple questionnaire, and this is what it looks like from the results side. So if a patient has filled it out, a provider can come in and look at the results. The patient is encouraged to fill it out on their side if that's what the video visit is for, but if they don't, the provider can also walk them through this to get the information that they need. if they have a temperature, how long they've had it, what medications they've taken, and also some relevant information about their past medical history. So there is that opportunity on this side too. In addition, we've put in the ability to store medical history, medical readings, and a symptom tracker. And this will be mirrored in the patient side also, and I will walk through it on the patient side. So we're going to go ahead and go to the patient side now. And you'll see for the patient side, it does mirror the navigation on the left. They do have this same video visit schedule. So this is the schedule of their appointments. Some helpful information to allow them to learn how to use the tool, but also some relevant educational content. So we've set up the ability to link to different areas on the CDC's website that the CDC is updating almost hourly at this point, to get them relevant information about symptoms, prevention, what do I do if I have symptoms, and how I manage anxiety during this time. In addition to that, as I showed you on the provider side, they have the ability to come in and fill out that video visit form that I showed. But they can also go ahead and click into medical history, and this is where they can store medications, conditions, and allergies. And again, anywhere where there's the plus button, they can add that information. Under medical readings, what we've put in here are vital signs, so they can store their blood pressure, their temperature, their respiratory rate, and their pulse. They can also store their weight. And in addition, they can store their blood glucose and their blood oxygen saturation. So all the things that they would need, not just for COVID-19, but for handling chronic conditions. And then we put together a symptom journal. And this journal is, again, specific to Corona. And what it asks is for your temperature, if you have a cough, if you're feeling short of breath, and then it also gives them a space to track other symptoms that they're having. Maybe they want to be documenting things that are going on every day that they can then see for themselves, but also share with a provider. And the way that displays, once they've put it in, is on a daily basis. They can go back and look at any of the other days that they've been tracking this. So we wanted to keep it as simple as possible. In the back end, one of the things that I didn't mention is that there is an alerting system. So for certain biometrics, providers can be alerted to certain biometric data that's coming in. And just for future, the next things that we're bringing in the very near future are secure messaging. We're adding into this, but we're also adding a task manager. So you can send your patients tasks to do at home, much like a care plan. And that will be coming out very quickly, being added in to the tool. So I'm going to go ahead and we'll go ahead and join that video consult. So we're going to go into today's appointment on April 1st, and I'm going to go ahead and click the join button. And then we join the video visit. And you'll see down in the bottom left-hand corner is me. Hi, everyone. And here is our provider, Amanda. In addition to being able to have this video consult together, to be able to use, to communicate, to be able to maybe share a post-operative wound, look at an infection, even look down someone's throat. We can do all of those things using the tool in addition to just having that face-to-face communication. But in addition to that, the technology also allows you to share a screen. So you could potentially share the results of an x-ray or share the results of a laboratory results with your patients. And that's the tool we've put together. We hope this helps you understand what we've done. Take care. Bye.
This concludes the Talk with Your Doc presentation. If you have any questions or would like to be contacted by a sales team member, please visit the website listed and submit a request for more information.